started to be recorded. Please confirm. All right, thank you very much. Well, I hope you can hear me well. Good morning, good afternoon to those in Europe and Asia. On behalf of the International Society for Telemedicine and eHealth, I welcome all of you to the 5th webinar organized by our society in this year. So, dear coordinator of the ISfTeH TeleDENTISTRY working group, Professor Márcia Rendeiro, and Professor Karen Bavarescu, Vice Chair and moderator of this session. Also, dear invited speaker, Professor Vinícius Carrar, from Rio Grande do Sul, Brazil, and dear affiliated members and colleagues and partners that are attending this webinar on teledentistry. Today, the very interesting theme of this webinar will be use of telemedicine in oral medicine, the telehealth RS experience, a session that will be moderated by both the chair and co-chair of the ISfTeH Teledentistry Working Group, Márcia Rendeiro and Karen Bavarescu from Brazil. At this moment, I would like to inform that this session, transmitted via any meeting platform, will be recorded. So, the content of slideshow and respective audio will be available to those colleagues that for some reason couldn't attend the live session today. The access link to the recorded session will be informed in around 24 hours and posted on the website of the International Society for Telemedicine and eHealth. During the webinar, a chat box on the left side of the screen will be available, so your comments and questions are quite welcome. At the end of the presentation, the moderator of this session will open a time interval of some minutes for questions, and a round of discussions is expected to be held with the active participation of the audience. So please use the chat box for that. Before going through the outstanding topic of this session, it's my mission and honor to say some brief words about the ISfTeH, mainly directed to the audience that is not yet familiar to our society. So, I'm changing to the first slide right now. Okay, the ISfTeH is a democratic, non-profit, and non-governmental organization in official relations with the World Health Organization, with its headquarters located in Basel, Switzerland. The mission of the ISfTeH is to facilitate the international dissemination of knowledge and experience in telemedicine and eHealth, and to provide access to recognized experts in the field worldwide. Next, please. Yeah. So the society nowadays has affiliated members from over 100 countries. You can see the list of countries that have affiliation to the International Society for Telemedicine. So you see that the number of people involved in this big network nowadays is really very, very significant. Well, in order to achieve its objectives, the International Society for Telemedicine counts on different working groups. You can see so many working groups like education, students, telenursing, teledentistry, a new working group that started this year, telecardiology, and several others like eHealth economics, collaborative care team in open source that this year organized a webinar, chronic disease management, very important, teleurology, teledermatology, women working group, francophonie, teleaudiology, and so far. So we have those working groups that are active and that support some activities that are part of the ISfTeH world. Next slide. Yeah. So the society used to organize annual conference, international conference. In this year, the annual conference of the ISfTeH was held in Helsinki, Stockholm, in a cruise in March. So that was really a very, very interesting meeting. In the next year, change to this next slide. The conference will be held in Lisbon, Portugal. So you are all invited to participate. That will be part of the Portugal eHealth Summit between the 19th and the 22nd of March. And the first 2 days will be the ISfTeH annual conference. So you should consider traveling to Portugal to participate and to join us. Oh, sorry, I just skipped one slide. Also, the society organized, as we have today, a series of web conferencing sessions with participation of so many colleagues and specialists, people that can bring and add value to our session. So both for students, nurses, and different areas of e-health. See the next slide. Okay, so also the society publishes its newsletter on a quarterly basis, and also the journal of the International Society for Telemedicine. So that's another kind of activity, and very important, that the International Society offers to its affiliated members. Here is an example of the journal of the International Society that is has as its main coordinators, Professor Maurice Mars and Professor Richard Scott. Okay, and the society has different membership categories, so companies, institutions, associations, individuals. Now we have a new category that is corporate startups that can affiliate to our society, and nurses and students that are free of charge membership categories. So there are so many options to affiliate to our society. Requesting affiliation is a quite easy process and can be done directly through the How to Join area on the ISfTeH website. Here we offer, once again, the ISfTeH website, so you can find all kind of information I said in the last minutes on the website. So now, going directly to our webinar, I'm very pleased to announce the chair and co-chair of this session, Professor Márcia Rendeiro from Rio de Janeiro, Professor Karen Bavaresco from Rio Grande do Sul, and our invited speaker, Professor Vinicius Carrar, that will speak about use of telemedicine in oral medicine, the telehealth experience in Rio Grande do Sul state. So, at this moment, right now, I invite Professor Karen Bavaresco. She has moderator privilege and can start the presentation of this webinar. I'm just changing to the next file. Just a second, please. And then
good morning, Adolfo. Good morning, all participants. Thank you very much for this opportunity. Nice to talking in this webinar sessions and to introduce you our TeleDENTISTry working group. So when they are changing the slides, just wait for the begin.
yes, I'm changing to the first slide. Unfortunately, that was not expected, but it was in the mid of the presentation. But I think now that will be okay in just a few seconds. So, Professor Karen, welcome once again. Please, you can start.
Okay, so I'm going to talk a little bit about our working group. And this work group has been coordinated by Dr. Marcia Rendeiro, and I am the vice coordinator. We are really pleased to be here. Our TeleDENTISTRY working group starts in April 2012 during the annual scientific event in Luxembourg in 2013. The formula is the creation of TeleDENTISTRY working group, and we are trying to make this huge and strong group, and we would like to invite all of you to join us and to make this TeleDENTISTRY group a really strong one. We have some goals for the working group, and we are trying to reach at least 20 members per year. To create a communication channel that we can change experience and can change collaboration in working and research. To participate active collaborative working group with participants of many different countries as possible. Nowadays we have lots of participants from Brazil, and we want to get some participants from other countries. So bring about interesting and up-to-date subject for debate, and also interacting with other working groups, and promote the participation of all the dentists, and start to develop some apps and some courses, distance education courses. So we are going to start now with the Professor Vinicius Carhart, that have been working a lot of teledentistry and have working a lot with telediagnosis. So you're going to talk about oral medicine and the experience of telehealth Rio Grande do Sul in Brazil. Professor Vinicius, it's nice to meet you again. So we can start now. In the end of the presentation, we have some few minutes about chat questions. Professor Vinicius.
Good morning, good afternoon. Firstly, I would like to thank for the opportunity to be here today. It's an honor and a pleasure to share our experience with you all. My name is Vinicius Coelho Carrarge. I'm professor of oral pathology in the School of Dentistry at Federal University of Rio Grande do Sul, member of oral medicine unit in Hospital de Clínicas de Porto Alegre, and also I take a part of Telesaúde project that is called Telehealth RS in English. And my topic today is use of telemedicine in oral medicine, the Telehealth RS experience. Well, I started working around 10 years ago when Karen invited me. It was a huge challenge. I had no experience at the time. Everything was new for me. So initially, I was in charge to plan and to produce a distance learning course in oral medicine, and to answer consulting, synchronous and asynchronous, also related to oral medicine questions. So since then, we have working hard, and my purpose for today is to talk a little about this experience. Our main topics will be the context of oral medicine, or more specifically in relation to oral cancer. Then we're going to talk a little about telediagnosis, teleeducation, and referral system actions. And then we're going to talk about future perspectives for now on. It's important to know our context here in Brazil in relation to oral medicine, or more specifically in oral cancer. We have around 15,000 new cases by year, according to our institution that studied cancer directly. In our state, Rio Grande do Sul, that's the extreme south of the country, we have around 1,000 new cases by year. According to the World Health Organization, Brazil figures among the countries with the highest mortality rate in the world. Obviously, it's not proud for us, professors and researchers in this field. Moreover, we must recognize that the high mortality rate has been stable in the last decades despite all efforts, around 50% of mortality rate. That is very, very high. Reasons. Probably the moment of diagnosis is one of the main explanations for this. In this figure, we see the different kind of cancers according to the moment of diagnosis. Early stages appear in orange and different shades of yellow. In the left side, we can see the cervical cancer. Here we have almost 80% of early diagnosis. In the right side, prostate cancer. That figures around 60% of early diagnosis. However, for the mouth, less than 40%. This is terrible. We have to change this scenario. Please let me be clear. Let's see some pictures of oral cancer or the kind of cases that we received in our clinic. Please apologies for the photos. It's a little bit shocking, but it's relevant at this moment. Here is our expectation. 2 pictures of early diagnosis of oral cancer, but for us, this is very, very unusual. Our reality is to receive cases in that stages. Those stages here, I mean, very, very advanced. Here, the prognosis is poor. It's very difficult to treat patients at that stage. So, the picture here, we have the situation that is faced in different countries around the world. Why? The question here is why this occurs. Mouth is accessible to examination. Let's talk about about the reasons. Here is a picture of a typical man of the countryside in South Brazil. Here we are called gaúchos. Exposition to tobacco is high here. It's very, very high. One of the highest expositions in our country. The second point is alcohol drinking, high and increasing. And the third point could be sun exposure, also high, and a susceptible population, many white-skinned people here in South Brazil. We asked to the dentists about their experience and attitudes in relation to oral cancer. This was a research here in South Brazil. Here I'd like to show just one finding. The question was, what do you think about time dedicated to learning of oral medicine during graduation? In the left side of screen, we can see that theoretical classes or lectures, theoretical lectures, were considered not enough for around 45% of subjects. In relation to the practical training, it's a little bit worse, more than 70%. In conclusion, few time, few classes, no self-confidence to handle oral lesion. Taking this fact in mind, StomaToNet was created. Now we're going to talk about the second topic, telediagnosis. Today, this service is available for dentists and physicians working at public health services at an online platform. They can request telediagnosis reports in this link on the red arrow at the top of the screen. So, StomatoNet is a telediagnosis service for diseases that are present as lesions in the mouth. Our objectives was support health professionals on oral lesion diagnosis and treatment, avoid unnecessary referrals to specialists, and reduce waiting time in the referral queue to specialized services. Here we can see our working flow. At the left side, professional at primary care take pictures of the lesions and send some information to a general dental consultant that analyze the basic information and the quality of photographs. And then, if it's okay, this request is sent to a specialized dental consultant specialized in neuromedicine. This professional define the final diagnosis or many hypotheses, suggest additional tests if necessary, and recommend a management that may be to treat the patient at primary health care or to refer this patient to a specialized service. Here we can see the form with the information necessary to confirm the request. Today, we request only few information more related to anamnesis, like duration of lesion and other diseases that patient present. We also prepare a tutorial to take pictures with smartphone. That's a request, a required point to validate the request. So this measure increase the quality of the pictures. Now we're gonna see some cases. The majority of cases are very simple and can be managed at primary health services. Here, an infection by candidiasis that has a treatment related to a drug, a medicine. So it's possible to deal with this kind of case in the primary health services without the necessity of refer the case to the specialist. I'm gonna show some cases. Another lesion, a small lesion that could be managed at primary health service, since some dentists are capable to do the biopsy, but it's not a reality for all. And here, maybe the most important cases, kind of cases, that is oral cancer. The picture is not perfect, but is enough to a specialist suggest diagnosis of oral cancer. So for this case, the recommendation is to refer the patient to the specialist to get a faster diagnosis and treatment. Another case, apologies for the text in Portuguese because I have no time to translate. But here we have ulcerative lesion in the posterior part of the palate. The patient was a smoker, had a prosthesis, and duration was around at least 3 months, between 3 and 6 months of duration. So here, once again, the suggestion was oral cancer and was confirmed by the applicant when we talked together later. And here, another case of oral cancer that was confirmed by applicant. So here we can show that the service is is feasible and can reach the diagnosis in many cases. Here once again, the same lesion in the posterior border of the tongue. Another possibility with this kind of service is a collaborative care. Some cases could be treated by the dentist or the physician and primary health services, and then another discussion to decide if the treatment is okay or it's necessary to change the treatment. Here in different moments, the subtitles is wrong. The left we have the April and the right is May 2017, and there was a crust in the left side, and then the crust was, and there was a remission, so the patient can be follow up that is possible at primary health services. Our first month of experience with the services was published in a paper, a recent paper. Here we can see the characteristics of the applicants. The majority was dentists. Few physicians used the service at the moment. In relation to satisfaction, we can see that majority was very satisfied or satisfied with the service. So this was a interesting finding of this first research. Here we can see the distance to the nearest oral medicine facility in kilometers. So for the public health services, an important information for economic reasons and also to get faster diagnosis. And in relation to the type of the lesion, we can see that majority was nodules or patches. At the bottom of this table, we can see that the recommendation is referral to specialists in around 43% of cases. But in contrast, other cases may be treated at primary health services. So this is very important finding and show the importance to the service. Here are some pictures that we received at the service. Different kinds of lesion, benign lesions, potentially malignant lesions that has a risk to transformation in oral cancer. And at the bottom, different cases of squamous cell carcinoma, the most common type of cancer. Well, let's talk a little about the education actions that we also developed around these years. The first experience, as I said earlier, was planning a distance learning course. And I call this first experience as first generation of the course from 2009 to 2014. The principles at that time was transference of knowledge. The lecture was based in PowerPoint presentations with narration, and we tried to perform a pre and post test to assess the impact or the effectivity of the course. The syllabus includes these topics: clinical examination, complementary exams, and different kinds of lesion. And at the third edition of this course in 2013, we decided to make an initial survey on the impact of the course and the perception of the attendees in relation to the course. And here in the left side, we can see that before taking the course, around 33% was insecure or very insecure in relation to the management of oral lesion. And after taking the course, we have an improvement with 93% of the students more secure in relation to deal with oral lesions. This was a first sign of the course is okay, but of course it's always necessary to make changes. And at that time we look for another way to assess the impact of the course, more specifically in relation to the ability, diagnostic ability of students, if this parameter is improving or not. And then we found this paper of a Spanish group, Juan Seoane, and the paper was published in Oral Diseases. And this paper proposed to assess the diagnostic ability in relation to oral lesions using clinical photos of lesions that should be classified as benign lesion, potentially malignant lesion, or malignant lesion. Here we can see the categories of clinical cases used in this test. So different kinds of lesion that was chosen according to the prevalence of lesions in that country. So these researchers find 57% of sensitivity, specificity of 53%, and the right classification of 54% of the cases. So we based our method of evaluation in this paper. Here we have some results of our experience using this method in an edition of the course, the last edition of first generation of the course. So here we can see one of the issues that appear at the moment, attendance in the course. Here at the bottom we can see highlighted in a red box that many people, few people stay at the course at that final. Only 55% attend the course, the entire course. So this is an important problem here. And as expected, the performance was better for specialists that was used as a gold standard. Dentists have better performance in relation to non-dentists. Here we have nurses and nutrition. And another problem that we detect for was non-response rate. Many people did not the post-test, and this was important because we cannot assess the efficacy of the course. Some pictures using this test that was of International Agency Research in Cancer for World Health Organization. So, limitations of distance learning perceived at that time: low frequency, feeding off abdomen of students, lack of training for professors and also students, and few pre and post tests answered by the attendees. Sometime later, we decided to change the methods of the course, and here we're going to talk about the second generation of the course that started 2016 since now 2018. Now, in the first edition of the second generation, we had students, dental students of the first and the fifth year, 10 units on the syllabus, duration of 20 hours, self-instructional basis, flipped classroom based, continuous evaluation process, pre and post-test was an obligation to conclude the course, and a grade of 7 or more in the post-test as the criterion to be approved in the course. We use different learning objects, reading material that included detailed information, high quality images, information focusing on clinical reasoning of the specialists in relation to each kind of lesion. And we used more flowcharts, tables, avoiding traditional and dual tests. We also use YouTube videos focusing on the reasoning again, like problem-based learning. Duration was short, less than 15 minutes. And we also prepare a virtual training room that was an innovative activity methodology to stimulate participants to learn. So here we have some screens of this learning object. So the first edition of the second generation of the course occurred in 2016. This was an advertisement of the enrollment process. Another question that we intended to address was frequency, engagement, and the sensation of abandonment. For this, we created a Facebook group where the materials, the launching of the materials were signalized. Here we can see some of the posts that we made. We also use this strategy to be more fun, to become fun, the course, and to signalize that the course is finishing. So the social interaction was interesting and have good results for us. Here, one example of the chart used by step to get a diagnosis. This kind of approach was interesting because the adoption was higher. It was less boring than a dual text. That is a traditional manner of to develop this kind of knowledge. Here, the training room, the virtual training room that we made. So different kind of cases could be assessed. And then the participant choose one case and can explore, asking for help, clinical data, or even a table with a summary of the topic. So the student can use different kind of helps to get a diagnosis, or simply verify the answer and conclude if it's okay or if it's wrong, their reasoning in relation to the case. Here we can see the two options of health activated. At the top, the clinical data, and at the bottom, the table with information that could help the participant to get the diagnosis. And here, the answer, in this case, leukoplakia, a potentially malignant disorder. And here we have some summary of the information in relation to the diagnosis. The outcomes that we use in this course to evaluate the effect of the course. The first was the diagnostic ability test that was based in photos, clinical photos, with no information in relation to the case. And also in relation to the management, or what was the position, the decision of the participant in relation to the case as a parameter of self-efficacy, to treat or not to treat this case. What do you do? Refer to a specialist, diagnose but not treat, or diagnose and treat the case. So here we have our criteria to assess the self-confidence of the participant before and after the course, and to assess the self-confidence. Here we have a picture of the participants of the first edition of second generation of the course. First year students accounting 32 and fifth year students accounting 37. This was our first experience at that time. I am in the right side with white shirt. Here we can see the findings of the course in relation to classification of the lesions as benign lesions, potential malignant disorder, or malignant lesions. So we can see that 5-year students that are in the final of the course have a higher performance. And for both groups, there was an increase of the performance after the course in the post-test for the right classification and also for clinical impression. The second answer was, what is your diagnosis for this case? And here the answer is closed. We have to suggest diagnostic hypothesis. Sensitivity and specificity also increased in the second evaluation, showing that the course was effective. Another parameter is the impact of the course in the working flow. What do you do with this case? And here we can see a reduction of intention to refer the case to a specialist. Once again, it's an important, interesting finding. It's one of our aims to reduce the number of cases referred to specialists. And the right side, the self-confidence to treat, specifically in relation to benign lesion, we can see another aim, another purpose of our course. I mean, to increase the resolvability of the professional working at primary health services. So here we have this first edition of the second generation of the course as a pilot to be applied in the second moment to the professionals working at primary health care. This findings was unexpected for us. So the second step at that time was to offer this second generation of the course to the professionals working at public health services and also to students from another universities. So we published an announcement in the Facebook and it had 2,000 views. It was very, very unexpected for us. And then the course started to the second edition. And here we have the findings, the results of this action, once again showing an increase of diagnostic ability by different variables, classification of lesion nature, diagnostic hypothesis, sensibility, and specificity. All the parameters increase in the post-test evaluation. And once again, looking to the intention to treat and self-efficacy to manage benign lesions, we have also interesting findings. So for this second generation, we have 4 editions. The initial edition with 69 students, as I said before, and then another editions with very high number of enrolled participants since so far. So the next point is regulation system. We have here a very important issue. There's the referral queue that accounts with 375 patients when this action started. The time for consultation at that time was around 2,200 days, with the capacity of accept 60 new patients by month by the specialized services. So the situation is very, very difficult to deal So the action was planned to change this scenario. The first action was to create a referral protocol with the content in the referral form well defined. So the applicant have to describe the lesion, include signs and symptoms perceived in the patient. If white patch, determine if this patch was removable or not by scraping. Any previous treatment was tried, and if having biopsy, what was the result. So this is the required content in the referral form to get the patient referred to the specialist. Based on this protocol, it's possible to determine the level of priority. So initially we have I forgot, a queue. Here, at this scenario, it's impossible to define which patient have to be evaluated before. We have a blind queue. No kind of prioritization at this moment. So here, with the proposal of telehealth RS project, it was possible to determine what patient have to skip the line and be treated, examined and treated before. So here we have risk definition and priority level as well. Now we know where is the most important cases. And here we can see the results of the intervention. The intervention was in May 2015. So since then, we can see a decrease in the time to get consultation in red, and also in the patient's referral queue in blue. So this graphic can show the results of this initiative. Well, next steps for telediagnosis is important to define the impact of the service on the squamous cell carcinoma stage, oral cancer stage, in the beginning of the treatment, because we are changing the situation for diagnosis, but after that it's important to get the treatment fast. So this is another challenge to be faced in the next months or years. For teleeducation, to assess if self-efficacy has relation with diagnostic abilities, and also to prepare, to plan some kind of courses to oral biopsy, because another issue that should be addressed. For the referral system is important to deal with the question of treatment, because after diagnosis, the treatment is slow to be reached. Well, this is our experience that I want to share with you, and now I am available to questions. Once again, thank you for the opportunity to be here sharing our experience.
Thank you, Professor Vinicius Carrar, for this very interesting presentation. On behalf of the ISfTeH, I thank you once again for presenting so important results of your activities, also presenting some interesting initiatives for the diagnosis and treatment of a sort of oral disease, some of them oral cancer, a clear attempt to achieve an early diagnosis and to speed up the referral to specialists. So once again, I'd like to invite your colleague and Vice Chair of the TeleDENTISTRY Working Group, Karen Bavarescu, But at this moment, I'd like to thank the participation of the audience. I see so many people from different countries, from France, for example, the coordinator of the open source working group, Professor Etienne, also Mrs. Claudia Bartz, a nurse that is one of the coordinators of the telenursing working group, Mr. Frank Livings, director of the executive director of secretary director of the International Society for Telemedicine, and several other colleagues. So thank you very much. So Professor Karin, please, it's up to you to coordinate this at this point. Would you please open? Yes, thank you.
Okay, thank you very much, Dr. Vinicius, for your explain us about a little bit about what we're working here in Brazil and telehealth, Rio Grande do Sul. And now I'm going to open the discussion session, so you can ask Vinicius using the chat. It's open now. You have some few minutes to discuss. Some questions?
Just one more information, Karin. We are discussing now about the opportunity to offer our course to another countries, make the translation, of course. So we are looking for partners. If someone are interested on this proposal, we are open to discuss.
Well, once again, here is Adolfo. I see the chat box with some questions. For example, from Marcia Rendeiro, the chair of the TeleDENTISTRY working group. What type of public use the system? Who use the system? What are the connections?
Okay, thank you for the question, Marcia. The service is available to physicians and dentists from public health services.
Okay, and another question coming from Claudia Bartz, one of the coordinators of the telenursing working group. She says, I would like to ask why people wait so long to seek treatment.
It's an interesting question. In the literature, we can see many reasons to explain it. We have one point that is that people in general deny any kind of health problem and postpone the moment to look for a professional. This is the first question. In relation to oral cancer, we have another point that is important, that the lesion in the beginning have no pain related, is painless, so is interpreted as a benign lesion, as a recurrent after stomatitis, for example. So is one of the questions, one of the reasons to explain this situation.
And I have one question, Vinicius, to you. What's the number of specialists that you have as part of the telehealth service to provide this kind of advice? So how many colleagues do you have working in this service?
Today, only me. Only me. The service is increasing. Many requests, even more. So it's becoming difficult to deal with this service alone. And so we are discussing some changes in the near future.
Okay, yeah, definitely, because you have a lot of activities and answers to and questions that you need to answer. So
Yeah.
there is another question coming from Marcia Rendeiro, Rio de Janeiro. She asks, can healthcare professionals participate in the second generation course? Is it open?
I'm not sure, but I think that some services have any kind of partnership with the Telesaúde. So it's available for some professionals, but not for any professional from private service, for example.
Okay. Okay. All right. Well, Karen, please.
So we are ending this discussion. Vinicius, thank you very much. Adolfo, thank you for the invitation, and all the participants. So I think we're going to end the session. It's 10 o'clock in Brazil. We have any more questions, you can contact us by email, can contact Vinicius. Thank you again, Adolfo, for this opportunity.
Okay. Well, before closing the session, I thank the audience for attending this session once again. This is the last webinar in 2018. We expect to have your participation in 2019. So before we have our official annual meeting in Lisbon in early March, in mid-March, in fact. So after that, we restart the webinars, and I hope I can count on the TeleDENTISTRY working group for 2019 again. So thank you all for attending this, and goodbye. Wishing you a very nice celebration of Christmas and Happy New Year. Bye-bye.
Thank you so much. Bye-bye.